HealthLink, Idaho. Before we begin this next conversation, I do want to take a moment and give a disclaimer. Our next segment will be dealing with discussions of drug abuse and overdose. Now, it's a topic that can be sensitive to some, and this content may not be suitable for all viewers. But if you are looking for information, you can visit healthandwelfare.idaho.gov. The reason why we have decided, though, to continue with this topic is the fact that in Idaho, fatal and non-fatal overdoses have increased 33% from 2020, with a large portion of deaths involving fentanyl. That is a very alarming statistic. But the Idaho Department of Health and Welfare is making steps this year with International Overdose Awareness Day to better educate people about drug addiction and overdose. So we have with us today, we have Sarah Buchanan and we have Courtney Boyce to tell us more. Ladies, thank you so much for joining us here today. I know it's a very sensitive but very important topic. And let's begin, though, by explaining International Overdose Awareness Day. So give us a little background on this.
Absolutely. International Overdose Awareness Day is a day of remembrance. It happens on August 31st and the largest annual campaign to remember those who have died from overdose. This year, we will be having an event at the Idaho Capitol to highlight stories across the state, as well as having a proclamation reading and remarks from Governor Little. We really encourage communities across the state to host events, as it provides an opportunity to talk about ways to save lives, reduce drug-related risks, and improve the health of communities.
And why raise this awareness? Why should we be thinking about overdose?
You know, Melissa, overdoses have increased across the nation and state. As you mentioned, fentanyl is killing folks across our state. We saw a 33% increase from 2020 in overdose for all drugs. You know, substance use is a chronic health condition, and we believe that folks deserve to have a long and full life. And so we want to take steps to protect them and save their lives.
Yeah, you made some very important points right there, right? That this is it's an illness, right? Substance addiction is an illness. And on top of that, this is something that can be prevented, right? So how do we prevent fatal overdose and non-fatal overdose, just overdose in general?
There's a few things that people can do starting at home. They can make sure to lock up their medications safely, keeping it out of the hands of other family members, friends, children, people who are not educated on that medication, and also disposing of those medications when they're no longer needed or no longer wanted. An example of that is to tear drug deactivation pouches, or they can use their local prescription take-back location. People can also know how to prevent and recognize and respond to an opioid overdose, including the signs and symptoms, and they can receive a free training from their local public health department on how to do that. And then making sure to carry, acquire, and administer naloxone to people who experience or appear to be experiencing a drug-related emergency like an opioid overdose.
Okay, and you mentioned naloxone. So what is it, and why should people have it, and where can they get it?
Yeah. So naloxone is an opioid antagonist. It bumps the opioids off of the receptors for a period of time, and that resumes that person's breathing and reverses the signs and symptoms of an opioid overdose. So they can get it from a few different places. They can get it from their local pharmacy, so they can find a pharmacy that has naloxone in stock by looking at findidaho-testing.com, or they can contact 211 for local resources. And then it's important for people to carry it because it starts a conversation on how folks can reduce the risks and harms associated with substance use. And they can also look at overdose prevention planning and having digital resources for that, but making sure that folks know how to prevent and recognize and respond, and they can get it from a pharmacy or their local drug use or health program.
Yeah, it sounds like education is first and foremost when it comes to preventing this. So those who aren't dealing with the illness of substance addiction and abuse can actually recognize when there is an issue for somebody, and they can be present and help them, and then have these items available if they ever do need to intervene, right?
Absolutely.
So where can people go so they can start that journey of education so we can all prevent overdose and, reduce that percentage that we talked about in the top of the conversation?
I think people should start with their local public health department. So
Okay.
Central District Health serves Ada, Boise, Elmore, and Valley counties, but each public health district has a drug user health program through the Idaho Department of Health and Welfare. So they can get a training, it's a free training, and they can learn a little bit more about these tools and education that can help support them. Starting there can be a great conversation, and then having a conversation with people who use drugs on how they can minimize the risks associated with substance use.
Excellent. Ladies, thank you so much. Greatly appreciate you coming on and talking about such a sensitive and difficult topic, but one that is just so paramount and important in our state, and especially during this time. So thank you both, Sarah, Courtney. All right, everyone, I certainly hope you've taken this conversation to heart. We have more Idaho Today coming up right after the break.